Hi, myself Kajol Hanchate and my partner name is Shweta Patil, and today's our topic is dosage form. In that we have taken a subtopic of liquid dosage form. Introduction. The liquid dosage form are usually liquid in state, and this form is specially preferred for children. As we know, they create a lot of tantrums while taking any kind of medicines. Next, it is prepared by dissolving active ingredient in a solvent by using suspending agent, which can be of two different system or both can be involved. The one can be oil and another can be the water system. So now I'm going to classify liquid dosage form. Liquid dosage form are basically of two types. They are monophasic liquid form and biphasic liquid dosage. In case of liquid dosage form, it is also called as true dosage form as it has homogeneous mixture. Two different components cannot be seen and they are properly mixed together. It can be consist of two or more substances. One phase is always a solvent and another is always a solute, and in this way homogeneous liquid dosage form is prepared. Next is biphasic liquid dosage form. In this you can clearly see two different phases of the liquid and it is called as heterogeneous. It also include undissolved form of drug which can be easily seen, and another solvent system is used as a vehicle. So I will give you the different types of monoliquid dosage form. Which are it? Mixture. So in case of mixture, it can be used as a medicinal form, and the proper example is the picture which I have shown you below, that is of carminative. Next is syrup. Syrup are usually the concentrated form of sugar which can be simple flavored or medicinal syrup. The best example of syrup can be the honey syrup, or you can even take an example of cough syrup. Next, elixir. Elixir are usually aromatic. Hydroalcoholic content is its main content and it can be sweetened or clear substance. The below picture is of elixir. Next, draught. Now draughts are usually given for pediatric purpose, and it has a single dosage container of 50 ml. You have to take it one complete dose. It is usually of pediatrics, and below example is of laxative. Next, another example of monodosage forms are linctus. As we all know, cough syrup is considered as linctus. Next is drops. Drops are prepared in such a way that a single drop of liquid is given as a form of medicine. It can be clear, sweetened, flavored liquid. It is again recommended for pediatrics as baby or infants have small mouth and you can give them a medicine in a form of drop. Next, tinctures. Tinctures can be alcoholic or hydroalcoholic. This solution is basically or usually concentrated from vegetables or organic substances. Next is spirit. We all know that spirits are 100% alcoholic substance, and this can be used as a medicinal purpose or a flavoring agent. In case of medicinal purpose, it is basically given for inhalation purpose and clear the nose infection. Next, aromatic water. We are very familiar with this concept or this point, that aromatic, like you can take an example of rose water. It is an aromatic water. It can be volatile or it can be non-volatile. It is a clear solution usually used as a perfume vehicle. Next, now, for the external use, first is liniments. Liniments are usually alcoholic or oily solution. In this case, liniments are used on a skin as it reduces friction, and the very important point to remember about liniments that it should not be applied on broken skin as it causes lot of irritation. Next is lotions. Lotions are usually clear oily aqueous substance. As winters are approaching, we all use lotions to prevent from dryness of the skin. Next is colloidals. Colloidals are properly used for external purpose, and the main point to remember about it can be used by using brush or a rod to apply on our skin. Next is for special use. We all are familiar to the eye drops, as eye drops are used to put in our ears the solution to reduce our infection or to reduce the mud in our ears. Next is eye drops. Again, this can be oily or aqueous solution which can be instilled our conjunctival sac to reduce the infection. Next is eye lotion. It is an form of solution which can be directly applied on the border of our eye. Next is nasal drops. Nasal drops are usually aqueous in state, and this is used to reduce the mucus in our nose or to reduce the infection in our nose. Next is enemas. Enemas are also called as clysters, and this are usually given in our rectal to clear the dirt from our rectum. Next, douches. Douches are usually the word is used for vaginal cavity. It is used to rinsing or purging our body cavity. Next, gargle. Gargle, as we have faced a corona situation, and in this we have used a lot of gargles to clear our throat infection. Usually this gargle are diluted in lukewarm water. Next, paints. Paints are the vehicle which are viscous in state and which is applied on a layer of mucosa with the help of brush or an cotton. Next, mouthwash. Now I will give you the example of mouthwash. The very familiar mouthwash is Listerine or Colgate, which is used to clear oral infection or bad breath. And again, this solution is used in a diluted form. Even some solution in this case are used in a concentrated form. Next. Irrigations. Introduction with the help of tube. It is directly given to the bladder or vagina and less often used in a nose. Next, sprays. Sprays are aqueous or alcoholic or glycerin solution which again can be used for the throat infection or even the nebulizer or atomizer. As we all know, nebulizer is something which gives out the steam, and in that form even drugs are given. Next, inhalation. Solution administered to the nasal or oral, and then it goes to the systemic in our body to get absorbed in a blood. Next is parental. We are again familiar with different types of family parental solutions, that is in intravenous, intramuscular, subcutaneous, intradermal. All the solutions which are prepared, again they are of liquid dosage form. Next, I'll tell you biphasic liquid dosage form. Now, what are biliquid dosage form? Which have two different phases, and we can clearly see, like the very well known antacids can be classified into suspension, as they give the like special note that you have to shake it and then you have to drink it. As if you keep that bottle for the long time, the suspension, the main drug will get settled down and the another form will be at upward side. So they always tell you that shake before you use. Then next is emulsion. Again, the porous dispersion of liquid. It is an heterogeneous system, and minute form of doses are above the liquid and the main phase, that is external phase, is below that. Next is its application or its type. For external use, the first is application. This application are usually applied on our skin to reduce the dryness or the friction. Next is liniments. Liniments are again used on our skin, or even liniments are used to massage the body of the babies. Next, lotions. Again, lotions are used to reduce the dryness. Even it is applied on the wound as to reduce the infection of the wound. As we know, there are different purses form in our wound. To reduce this antiseptic lotions can be used. Next is for the special use. The very first example of special use is enema. Again, it is administered in the rectal, and you can see the image how it is inserted and how it works. Next is eye drops. Again, eye drops is inserted in your conjunctival sac to reduce the infection. Next is inhalation. Inhalation are usually the volatile oils or absorbing agent which are given in form of vapors and inhaled through our nose. Next is eardrops. Eardrops are usually suspension or aqueous solution which are instilled in our ears to reduce the infection or to remove the dirt from our ears. As the picture mention how to use it. Aerosols again, when you are using aerosols, we usually think that it is in a gaseous form, but the concept is wrong because the drug which are put into the aerosols are liquid and the applicators are in such a form that it come in a form of spray. As picture shows the great idea of aerosols. Next, multiple choice question. Now this is going to be discussed by my colleague, that is Shweta Patil.
So now we will discuss multiple choice question. The very first question is the liniment must not be applied on the dash skin. As per we will discuss the presentation, the liniment must not be applied on this broken skin. Then second question is the syrup is dash in nature. As per we will discuss, the syrup is aqueous in nature. The third question is enemas are also called as per we will discuss presentation, the answer is clister. Then fourth question is the monophasic liquid dosage form is dash in solution. The as per we will discuss slides, the monophasic liquid dosage form is true in solution. Then next slide is overview and reference. The overview is liquid dosage form are essentially pharmaceutical product which involve two types. First is AIP and non-drug component. AIP means active ingredient pharmaceuticals product. Second point is liquid dosage form of dose of drug used in medication intended for administration or consumption. The third point is classification of liquid dosage form are based in two different points. The first is a physical and chemical properties. Then reference is Dr. A.K. Set, a textbook of pharmaceutics edition 2017 PV books page number 238 and 2 to 357.
Thank you for patient listening.